raising the profile of eye health and have been doing probably each year for a number of years now. The biggest thing really is the vision van, which is on the road, actually not necessarily in the York area at the moment, but down south, but also that's sort of on-site sort of mobile testing, if you like, which is very good. Makes it accessible people, makes it easy for people to actually sort of go and have an eye health check. For most of us, over 80% of people feel that our eyes and our vision is the most important sense that we've got, yet 30% of people actually never bother to have an eye test on a regular basis. So it's part of your sort of health MOT, if you like, that just checking that how your vision is, but also checking how the health of the eyes are, and sometimes in other cases really the eyes can reflect other things that are going on in different parts of the body. So it's a good general checkup really as an MOT. The complications really for the eye health checks are sort of either visual impairment or eye strain, that sort of thing, so difficulty driving, or other things like eye diseases sometimes can be picked up a little bit earlier if you have a regular check, because some diseases don't necessarily give you symptoms until it would be later on in the process. So again, early detection is useful, and some of these diseases can be picked up with an eye test really as well. There's a condition called retinoblastoma, which is quite it affects children very early on, and so really Vision Express have put a process in place for children to have an early eye test really, say, and if there is any sort of worry or concern, then we set a specific sort of pathway to get that referred and investigated quickly really on that. So that sort of thing is important. Other sort of general screening checks really for children sort of preschool, just to check and see how they're getting on really, say. But the retinoblastoma one is our current sort of partner charity, if you like. So the lady who's the manager here, Judith, has done a lot of work really, say, to raise money and awareness for that.